we are facing a situation where we are being urged in this body to accept Medicaid expansion as the end-all be-all and the best part of this plan. And there are a number of reasons why that is an extraordinarily poor idea. As a federal government and as a country, we are currently $16 trillion in debt with an annual deficit of over $1.1 trillion. We borrow between 35 and 40 cents of every dollar that we take in or that we spend at the federal government level. Based on those numbers, it is almost impossible for us to ever repay the federal debt without extraordinary growth or extraordinary inflation. That's a major concern of mine because it makes little sense to me to put an expanded program, a permanent program, on our credit card. It's not what we do in our home budgets. It's not what we do with our households. We don't put our mortgage payments on our credit card. That's certainly not a long-term plan for success. Over the last 10 years, from 2004 to 2013, we have seen the federal government's reimbursement rate to the state of Iowa for Medicaid reimbursement decrease from 66% of what we spend here at the state level down to 59% of what we spend at the state level. The federal government has made promises through Obamacare that they're going to pay 100% for the first 3 years and 90% every year thereafter. Once we get down to that point, we ratchet down to that. But do we really believe that when we've got a $16 trillion deficit and a $1.1 trillion annual deficit that we need to repay? Now, I've heard a lot of promises made by politicians in this building, specifically on the other side of the building, that we're willing to put something into this that says that, you know what, if that figure ever drops below 90%, then we'll just repeal it. When the proposal comes to make that a constitutional amendment so that we can't go back on it without going to the people, I'd be happy to take them up, but in the meantime, I don't take them at their word on that. There are some other reasons why I believe that Medicaid expansion is not the best plan. I, too, have had significant discussions with my hospital administrators back home. And my hospital administrators tell me, Chip, Medicaid expansion is paid for. It's paid for through Obamacare, which Representative Olson put forward. And there's a couple of primary mechanisms that they claim that pays for Medicaid expansion, so we don't have to include it in the federal deficit numbers and incur debt on it. And there are two main things that are there. First of all, it's the medical device tax. It's a tax of 2-point-something% on all medical devices that are sold throughout the United States every year. And the other part of it is Medicare reimbursement cuts. The hospitals and doctors and healthcare providers agreed to take into consideration and to take those cuts when they agreed to support publicly the passage of Obamacare a few years ago. There's problems with both of those funding mechanisms. Only a few weeks ago, the United States Senate took a non-binding vote. Now, it's non-binding, I will grant you that. But they voted 79-20 to repeal the medical device tax. How stable is that of a funding source to pay for Medicaid expansion under Obamacare if before Obamacare ever gets fully implemented, they're taking a vote to repeal it? It's not stable. And when it comes to Medicare reimbursement cuts, we have heard time and time again in this state that the physicians and healthcare providers in this state, because they provide such excellent care to Iowans, are getting reimbursed at a rate much lower than the rest of the country, and they keep urging us and they keep urging Congress to increase their reimbursement rate. Do we honestly think, as we sit here today and listen to Medicaid expansion, Medicaid expansion, Medicaid expansion is the best way for us to go, do we honestly think that the healthcare providers in this state are going to tolerate long-term Medicare cuts to their reimbursement rates? And is that the best mechanism to pay for Medicaid expansion? It is not. And we all know that. We also all know that lobbyists are out there in Washington, D.C. at this very minute lobbying to reverse those Medicare reimbursement cuts. So when you take away the two primary sources of paying for Medicaid expansion in a state, you have no choice but to add to the federal deficit and add to the federal debt and start paying interest on the added debt necessary to pay for Medicaid expansion. That's why this is such a horrible idea for us to consider Medicaid expansion as the end-all, be-all in this state. It is not free, ladies and gentlemen. It is not free to Iowans. It is not free to United States citizens. It's not free to the federal government. We also have a system where hospitals in our state, and this is a conversation I've had with the hospital administrators in my counties, they levy property taxes in part for the purposes of providing care and treatment for those people who cannot afford it. In part, I grant you that the property tax levies that are out there go to a number of other very, very positive things. But it goes to infrastructure and equipment and all sorts of other good things that are done there. But in part, they have the power to tax for the public good. And part of that public good historically has been to provide care and treatment for those that cannot afford it. If we are intent on reimbursing hospitals for the care and treatment of people that cannot afford it, it is unfair to the property taxpayers in this state to continue to allow the county hospitals to collect property tax revenues to the full extent that they are now. I do not know exactly whether this plan is the best way to get that accomplished, but I think it's only fair to the property taxpayers that we do not have hospitals that get reimbursements for previously unreimbursed care and still allow them to collect the full amount of property taxes, that a part of which was supposed to be used
Representative Baltimore,
to pay for that.
your time has expired.